Hey everybody, and welcome to EMS Training. Today we're going to be talking about cardiac arrest. To determine if a patient is experiencing cardiac arrest and needs CPR, check first for unresponsiveness and obvious signs of death. To check for unresponsiveness, go up to your patient and use the tap and shout method. So tap them and say, hey, are you okay? If she doesn't respond, obviously she's unresponsive. To check for obvious signs of death, look for body decomposition, dependent lividity, injuries incompatible with life, so like decapitation, submersion for greater than 1 hour. Next, check for breathing and pulse. Feel for a pulse at the carotid artery, and to look for breathing, see if the patient has any chest rise. If the patient has no signs of breathing, no pulse, is unresponsive, and has no obvious signs of death, then radio vigilant and say 830 MM1, code 99, CPR in progress, and the dispatcher will notify you when a paramedic is en route. Then assign someone from your team and begin CPR. Once an AED has been retrieved, turn it on and apply the pads to the patient. Look at the pictures on the pads for where to put them, and then plug the pads into the machine. This will begin the assessment, so be ready to stand clear. Then listen to the AED's instructions. Is there a shock advised? Once a shock has been administered and the AED says that it is okay to begin CPR, then restart chest compressions, and you'll start from the top, not from where you left off. After 5 cycles of CPR or after 2 minutes, switch with your partner and reassess the patient with the AED. Then move the patient to a backboard or stretcher and transport. Finally, you're going to give a MedCom note, which we'll talk about later on.
When performing CPR, it is important to perform good quality CPR. So what does that look like? Compressions should be delivered at a rate of 100 to 120 per minute. A good way to keep track of this is by singing a song at 100 beats per minute in your head, like Staying Alive, Baby Shark, or my personal favorite, Dancing Queen. The ideal depth for chest compressions is about 2 inches. In the field, don't be afraid to use force to reach this depth. You may crack or dislocate ribs, but it's okay. You're the patient's heart, so you have to be forceful. Ensure that you have full recoil and don't start another compression until the chest has risen all the way back up. The transition from shocking to compressions and back again should be no greater than 10 seconds. And one good cycle of CPR is 30 compressions and 2 breaths with the bag valve mask at 15 liters per minute. Remember to switch with your partner after 5 cycles. CPR is a team effort. In an ideal situation, you'll have 4 teammates. The first person is the team leader who assesses circulation, breathing, and compressions. The second is AED prep, VVM operation. Third, airway management, controls suction and patient movement. And finally, we have the fourth person who is the compression takeover.
When performing pediatric CPR, a single rescuer will use the 2-finger method and deliver cycles of 30 compressions and 2 breaths. For multi-rescuer CPR, wrap your hands around the patient and use your thumbs to give compressions. A cycle for multi-rescuer CPR is 15 compressions and 2 breaths. For multi-rescuer CPR, switch with your partner after 10 cycles. To defibrillate a pediatric patient, use the pediatric pads if the patient is under 8 years old or weighs less than 25 kilograms or about 55 pounds. A Lucas device can be used instead of performing manual chest compressions. It is most commonly used when moving to the ambulance. To use the Lucas, lower the suction cup to the chest, select the appropriate setting, and give ventilations when the machine pauses.
So this is an example of pediatric CPR. This first one shows a single rescuer, and you're going to use the 2-finger method. The second one shows multi-rescuer, where you wrap your hands and press with the thumbs.
The final step in treating a patient experiencing cardiac arrest is given a MedCom note. A MedCom note is a warning sent to the hospital that a patient is en route. This is especially important with high priority patients so that the hospital can prepare to receive the patient. To give a MedCom note, initiate communications by saying in the bus radio, MedCom MM1. The rest of this slide is just a pony to give a general MedCom note. It can be used for any type of high priority patient, so fill in the blanks with the appropriate information. Then you're going to stand by for a response, MECOM may ask you about the mechanism of injury or nature of illness, allergies, medications, or any other pertinent past medical history.
When you get to the hospital, report this information, which includes age, initial rhythm, most recent rhythm, if it was witnessed or not, if bystander CPR was performed, the time since CPR started, the number of shocks and epi, other things like medication, pertinent history, airway, and ETCO2.
For more information on treating a patient experiencing cardiac arrest, you can take a look at the protocols. I'll just go through them real quick. You can pause the video here. And that's all we have for training today. So remember, it's a good day to save lives, train hard, and get after it. See you guys.